Good morning, and let's have some fun. What I'm about to show you is truly incredible. This is perhaps the best treatment in medicine, and I think this will start a revolution which will be regarded as a breakthrough for decades to come. I'm not going to try to convince you with some sort of mysticism or ethos. I'm going to show you cold, hard data. So let us begin. Let's start with a terrifying illness, Miller-Fisher syndrome. This is an autoimmune disease that's a variant of Guillain-Barré syndrome that attacks the nerves that control the eyes and causes ophthalmoplegia, paralysis of eye movements, and ataxia, clumsiness of gait. But you can see after receiving this treatment, 100% of the patients completely recovered from all of their deficits. It wasn't immediate, it took several months, but in the end, they all improved. What was this treatment that worked so incredibly well? Let us continue. The same treatment was received by this 77-year-old who presented with chest pain and was found to have a mass in his right lung. Biopsy revealed that he had non-small cell lung cancer. He received no chemotherapy, no radiation, and no surgery, and yet a follow-up CAT scan 3 months later revealed complete resolution of the mass, and just like that, he was cured. But can this treatment work for more chronic and difficult to treat illnesses? Let's take a look at chronic migraine. Most people with migraines have them come and go and do fairly well, but a select few have chronic migraine that affects them several days per month. But after receiving this treatment, the mean headache days per 28 days dropped dramatically by 4 weeks and just kept going down, and by 24 weeks they had significantly reduced. What about chronic low back pain? Perhaps the bane of our society. This is not quite as impressive. The patients were not cured, yet based on the visual analog pain scale, the pain immediately went down and stayed down even after a 1-year follow-up. So what was this incredible treatment? Well, here is where I reveal to you that I led you astray, because the one thing that these patients all had in common is that the treatment they received was absolutely nothing. Let's take a closer look at those studies. What I didn't show you is that the study on Miller-Fisher syndrome was actually a randomized trial for plasmapheresis, a procedure that removes abnormal antibodies. The patients who received plasmapheresis got better, but so did those receiving the sham treatment, because it turns out that this disease spontaneously remits. And I admit with some chagrin that I gave a patient intravenous immunoglobulin, a potentially very harmful drug, to a patient several years ago who got better. I took the credit for it, but in reality, he improved on its own. What about the lung mass? Well, it turns out this was a spontaneous regression of a locally advanced tumor. It's rare, but it does happen, and it has been reported with virtually all forms of cancer. What about the headaches? Well, this was actually a randomized trial of Botox versus placebo, and the trial was successful. Botox, the lower line here, was even better at reducing headache days, but notable that the placebo group did quite well as well. Why is that? Well, it turns out that migraine is a paroxysmal illness. Patients are constantly getting better at worse, and when they enter a clinical trial, they're often at their worst, and so they tend to get better based on regression to the mean. What about the back pain? This was a randomized trial of acupuncture versus a sham acupuncture, labeled MA, or minimal acupuncture. As you can see, both the sham and treatment groups got better immediately. The waitlist group, who didn't receive anything, did not get much better, and they all equalized by the end of the study. So what did we learn here? Well, things aren't always as they appear. And anecdotes mean little, because the placebo effect and the regression to the mean effect are very powerful. Sometimes a tincture of time works better than you think it would. And I leave you with Nietzsche. Most conscious thinking of a philosopher is led on secretly and forced into particular paths by his instincts.